Lucy Letby was one of the most disturbing cases in modern British history. A young neonatal nurse. Calm, polite, always smiling. Colleagues trusted her. Parents thanked her for caring for their newborns. No one could imagine that behind that calm appearance, something far more terrifying was unfolding. Her case left the entire United Kingdom asking the same question. How could someone responsible for saving lives become connected to so many infant deaths? Unlike many criminal cases, her early life showed no obvious warning signs. Lucy was born and raised in England as an only child. Her family life was stable. She grew up in a comfortable, ordinary middle-class home. There were no known traumas, no abuse, and no major incidents that could explain what came later. From the outside, she appeared completely normal, quiet, polite, and responsible. From a young age, she wanted to work in healthcare, and eventually, she achieved that goal. Lucy became a neonatal nurse in a hospital in Cheshire. She worked in a unit caring for newborn babies. Many of them were premature and extremely fragile. It was a high-pressure environment where every decision mattered. The staff believed she was competent and reliable. She was trusted with vulnerable patients. At the time, nothing seemed unusual. Before 2015, the unit had a relatively stable mortality rate. Occasional tragedies happened, as in any neonatal ward. But then something changed. The number of sudden collapses and deaths began to increase. Doctors started noticing unexplained medical emergencies. Babies who were stable suddenly deteriorated without warning. Some turned blue in front of staff. Others stopped breathing unexpectedly. Despite every effort, not all of them could be saved. In June 2015, one particular incident later became important in the investigation. A pair of premature twins had been born. Their condition was fragile but stable. Doctors were cautiously optimistic. Then suddenly, one of the babies deteriorated rapidly. Despite medical intervention, the baby could not be saved. The following day, the second twin also suffered a sudden collapse. This time, the baby survived after intensive treatment. At the time, no one understood that these events might be connected. Later, investigators uncovered another disturbing detail. After some of these incidents, Lucy Letby searched for the families of affected babies online. She viewed their social media profiles. She read posts about their losses and ongoing grief, and she returned to these pages repeatedly over time. This behavior later became a significant focus of concern. Meanwhile, the number of incidents continued to rise. One baby, then another, then another. Patterns started to emerge. In many cases, Lucy Letby was present during the shift when emergencies occurred. At first, colleagues struggled to accept this connection. They saw her as kind and dedicated. Some even felt sorry for her, believing she was simply unlucky to be on duty during tragic events. But the data began to tell a different story. The unit manager began a detailed review of hospital records. She compared shift patterns and medical incidents. A troubling correlation appeared. A disproportionate number of critical events occurred during the shifts involving Lucy Letby. These findings were escalated to senior hospital leadership. However, disbelief and hesitation delayed action. Some staff could not accept that a trusted nurse could be involved. As a result, the situation continued without immediate resolution. Over time, the investigation deepened. Specialists reviewed medical documentation in detail. They analyzed timelines, staffing records, and patient histories. A clearer pattern slowly emerged. Lucy Letby's name appeared repeatedly in connection with unexplained incidents, far too often to ignore. Eventually, the case was handed over to law enforcement. A full criminal investigation began. Detectives examined thousands of pages of medical records. They interviewed hospital staff. They consulted medical experts. In 2018, Lucy Letby was arrested. During the investigation, police discovered handwritten notes that drew significant attention. Among them were emotional and self-critical statements, including words suggesting guilt and distress. These notes later became part of the court evidence. The trial attracted global attention. Families of affected babies testified about their experiences. Many had believed their losses were tragic but natural. Now they were forced to confront a far more painful possibility, that some of these tragedies might not have been accidental. Lucy Letby denied all accusations. She did not admit responsibility for any wrongdoing. Throughout the trial, she often appeared emotionless in court, calm, detached, and silent, but the evidence presented was extensive. In August 2023, the court delivered its verdict. Lucy Letby was found guilty. She was sentenced to life imprisonment without the possibility of release, one of the harshest sentences in British legal history. This case remains one of the most shocking in modern healthcare, a story that changed public trust in hospitals, and left behind a haunting question. How long can something like this remain hidden in plain sight?